Back now at 9:12, Kratom. Have you heard of it? I'm going to guess that, chances are likely not. It's a tropical tree from Southeast Asia whose leaves are used as an herbal drug. And although it is legally sold in places across Oklahoma, the DEA lists it as a drug of concern. And there is now a recall for it. So here with us this morning, we have Dr. Hal Scofield with the Oklahoma Medical Research Foundation. Good morning, sir.
Good morning.
Thanks for being here.
My pleasure.
We do appreciate it. And you and I were just talking. Very interesting how much this drug has made headlines lately for a drug that nobody has really ever heard of.
Yeah, it wasn't very long ago. No one had ever heard of it. I saw a report, published report from the North Texas Poison Center, and they had not had a single call about kratom before 2009. And then it's progressively risen since then, since the report a couple of years ago, so that now it's some substantial percent of their, some real small but real percent of their calls.
Yeah, and as a doctor, you hadn't heard of it either. You said you pulled maybe 50 professionals, medical professionals together. And
yeah, and well, we saw a patient.
Not popular.
We saw a patient having a complication a couple of years ago, and when we saw it, I'd never heard of it when I saw that patient, and neither did anybody I could find. Maybe one out of 50 people I talked to, doctors I talked to, had ever heard of kratom.
So fascinating. So tell us, what is it exactly?
Yeah, it's, as you said, it's a tree that grows in Southeast Asia, mostly in southern Thailand, and then in Thailand and now in the United States, it's available in the United States. It's the leaves, and they contain two active ingredients, and the leaves are either chewed or brewed into a tea. And then those active ingredients, they don't really chemically look anything like opioids. Opioids like morphine and heroin, for that matter, and fentanyl and oxycodone, those kind of drugs. But the active ingredients in kratom bind the receptors in your brain that also bind the opioids. So they are the opioid receptors, and so it has similar effects to opioids. Although it appears to be it's sort of more energizing, more like an upper, or instead of sedating.
Okay, and I was reading it is part of the coffee family.
Yes, the tree is.
The tree is. And what would be the supposed benefits of taking kratom, as opposed to another FDA-approved medicine that you would use for those kinds of symptoms?
Well, nobody really knows.
A holistic approach of sorts?
Yeah, of course, it's a natural product, but so are opioids. Some of the opioids we talk about these days, or we give these days, like fentanyl, are modifications of chemical modifications of naturally occurring products, but the opioids are naturally occurring also, of course. And so it binds these opioid receptors, so it is used for pain relief, and although it's illegal in Thailand and has been illegal in Thailand since 1943, it's used for pain relief. It's used to treat withdrawals of opioids and alcohol withdrawal, and it's kind of used as an energizer, and so give something to give you energy. So it's not really known. It seems really interesting that, given how it binds the opioid receptors and which opioid receptors it binds, that it might be useful for pain.
And let's get to the recall that is out, because I know the FDA just announced a mandatory recall after a multi-state outbreak of Salmonella that was linked to kratom products, 132 people in 38 states.
Right.
What do you know so far about this recall, and is Oklahoma included in that list?
I'm not absolutely sure that Oklahoma is included in the list. It was a single distributor.
So I guess if places bought from there.
If places had bought from them, then they would have it in Oklahoma, and presumably the leaves were contaminated with, they were contaminated with Salmonella.
And why has this not been approved? What are you hearing from the FDA as to why this hasn't made the list yet?
Well, and then the FDA had a notice in the Federal Registry that it was going to be listed as a Class 1, which would put it in the same category as heroin and marijuana and other completely illegal drugs. And then they withdrew that notice. And that's really where, as far as I know, that's where it stands now, that notice was withdrawn, and it's not, so the FDA hasn't made any decision about it. There are a couple states that have made it illegal. Alabama has made it illegal.
Just curious, since you are a doctor, would you ever recommend that anybody take a kratom product of any shape or sort?
I don't know. It seems safer than, at least what I read about it and know about it, seems safer than opioids with less severe withdrawal, but there's definitely withdrawal. There's sedation, including respiratory, breathing sedation. So there's been some deaths from it. but overall it might be safer than opioids, but I think we got to figure that out. And so it's hard to make that, it'd be nice for it to be studied in a medical way, in a scientific way.
You're saying there's just not enough research. I
I
mean,
don't think
clearly
so.
when these headlines have come out, you know, everyone is saying, well, what is
What is it?
Kratom?
We never heard
I've
of it,
never
yeah.
even heard of that before. You know how many users there are in the United States?
I don't think anybody knows that either.
It's just a whole mystery surrounding Kratom. Have you heard any sort of testimony from anybody who's ever used it? Maybe not in person from actual patients, but in research, have you heard what people have had to say about using this drug?
Well, that it's less sedating than opioids, and more this gives you energy, and so it's kind of excitatory. But there have been a lot of complications, and the patient we saw had a complication that's very typical of opioids. So they had a complication that's very much like you get with opioids. And so it looks like, in terms of withdrawal and complications, it looks very similar to opioids.
If somebody is watching this newscast right now and they do in fact go to stores and they purchase this product in whatever form it may come in, what's your message to them right now? Because this is kind of a nebulous topic, and doctors, researchers don't really have all the answers yet. Would you say stop?
Yeah, I'd be very careful. I mean, I think the data from Thailand makes it look like it's addictive, although it is touted as non-addictive. But when you look at published medical research from Thailand, it looks addictive to me.
Okay. Dr. Hal Scofield, thank you so much. Anything else that you'd like to say about Kratom? Covered all the bases?
I think so.
All right. Thank you so much for your time. We do appreciate it, and looking forward to following where this story leads.
Good.
Shelby, over to you now.